So another common mistake that new harvesters make is under dissection at the knee. So we are excited to get the scope in there. We make our incision, we cauterize down. We might open up a little bit of a pocket with our scissors, and then we get our scope in there. We start dissecting. Under dissection at the knee usually leads to a situation where once you're done with your harvest, you've done your stab and grab, you're ready to pull the vein out, and you come back to the knee, and what you see coming out of the leg seems like it's tethered. So you put a retractor in, you look, and boy, just out of reach of that retractor is more connective tissue. And now once the vein is out and it's kind of floppy, it's laying in your way, that becomes a lot more difficult to dissect. Sometimes people ask, well, if it's just past the extent of my retractor, can I put my harvester back in and just take some of that tissue? You can, but two things happen. One, as you put your scope back in the tunnel, and maybe it's only this far, you don't have a lot of tunnel holding your scope up. And so it's really difficult to maneuver and to protect the vein itself as you find that tissue that you need to cauterize. And it's hard to line everything up and create the tension that you need, or the angle that you need to get that cautery across there. The second thing that it does is, because your vein is no longer tethered distally from where you're working, and remember, we want our C-ring with the McKay scope or the V-keeper with the Terumo scope, we want that past the area that we're working, because it kind of tethers the distal end as we cauterize through whatever's in front of that. When that vein has been pulled out of the tunnel and you're just kind of working with whatever loop is left, as you go in there, there's nothing to stabilize. And so sometimes that can suck the vein into the cautery. And sometimes, as I'm dissecting or trying to work that out, I've looked to see and I thought, oh, there's a huge branch there. That's the problem. And I go to cauterize it, and then I think, well, is that a branch or is that my saphenous? And I'll look, and I have actually, in one case, I'm embarrassed to even say this, but on one case, I transected a vein right at the knee because I was confused as I had pulled it out, and I was thinking it was connective tissue. So I just went in with the cutter, the V cutter, thinking, oh, that's my problem. It's this huge branch. So I went to cauterize it, and after I was done, I pulled out half of a vein, and the other half of the vein is, I was expecting to pull out one long vein, and I pulled out two shorter veins. Now, fortunately for me, it worked out fine. We cut the cauterized part off. We had plenty of vessel from the thigh and from the lower leg, so it was fine, but certainly embarrassing and unnecessary. So if I had taken just a little bit more time to get that dissected, it would be okay. The way you prevent this from happening is taking an extra few seconds right at the beginning of your harvest. So have your retractor in, you're freeing up your pocket, free up as much as you can comfortably with the scissors. And then when you get your scope, remember, we insert the scope vertically. We want to pop some windows above and below. And that's how we get that tissue freed up, is with this scope. As we start to march up our tunnel, if we've kind of popped windows above and below, now we're getting rid of a lot of that connective tissue. And we can come back to our knee, we can get underneath, and we can dissect some of that out. So popping the windows above, popping the windows below, right below the knee is what's going to fix that underdeveloped dissection at the knee that's going to cause you trouble down the road. Also, for underdeveloped branches, if you find that the reason you're having underdeveloped branches is you can't quite get the angle, you can't quite get the scope for whatever reason up to your branch that you need to dissect out on, don't forget to use your outside hand. You have another hand here that you can kind of basically, let's pretend, I'm going to push down on my tunnel, which is going to push this branch into view so I can then pop my windows above and below. Maybe it's just kind of superior, it's just out of reach. Sometimes up towards the groin, the vein takes a funny turn and it's hard to get that into view. So use your outside hand to push it into view, push more of that branch into a position where you can see it, and then you can dissect that out. The other thing you can do, which is a very low risk thing to do, is just extend your incision by 1 millimeter or 2. Literally, that's all you need to do. If it's just past that retractor, well, free up a little bit more skin so that you can move that retractor in a little bit deeper. Functionally, I don't think this makes any difference to the patient. I don't think that extra millimeter or 2 contributes to pain or prolongs recovery in any way. You do have to be careful as you get close to the knee just because of how much skin is moving at the knee. But if you have an issue and you can't quite get to that tissue, it's going to be better for the conduit if you open up that incision a little bit further to free that up rather than pulling that conduit down to get at that extra tissue. So extend your incision just a teeny tiny bit, and if that's not enough, a little bit more. Just keep it away from the knee joint itself, and you won't have any really downside to doing that.